Hi, everyone. My name is Reg Gibbs, and this is Steve Uhas. We're both here today to introduce you to the concept of rebutting a plaintiff life care plan. But first, I want to give some background on each of our experience in the field. So I'll start out. I've been in the life care planning field for about 20 years. I started out as a voc rehab counselor and worked for the state of Montana for about 3.5 years. Then had the opportunity to go run a pediatric clinic and a outpatient brain injury clinic for about 2.5 years for a local hospital. In about 2000, I started a present company, Rocky Mountain Rehab, and we now provide life care planning and vocational expert opinions throughout the United States. At present, we have 5 life care planners on staff and have a very busy practice. And this is going to be divided up to the first half. Steve will cover the introduction part of the rebuttal techniques, and I'll cover the last half. So I'm going to turn it over to Steve and let him give his background. And I will notify you that once Steve gets started, I'm going to shut off the video to both of us so you can focus on the slides. Turn it over to you, Steve.
Thanks, Reg, and welcome. And I'm just very pleased to be able to have this opportunity to share with you in these minutes ahead. As far as my background, I've been providing rehabilitation and consulting and catastrophic case management services for almost 34 years. I had an opportunity to work on a regular basis with different treatment teams throughout the southeastern U.S. and across the United States. I'm also a certified rehabilitation counselor and a certified life care planner and a certified case manager. I have opportunities to work with individuals that have had catastrophic injuries and developing both their medical and vocational rehabilitation plans on a regular basis, as well as part of my practice in working in this area of litigation, providing life care plans and vocational expert testimony. So it's great to be here. I look forward to getting to know you better, and hopefully we'll get to communicate in the days ahead. So with that said, we're going to go ahead and proceed with our topic. Reg, do you have any other comments before we begin?
No, thank you for that introduction, Steve. And I will now stop the video for you as well.
Here we go. As far as our title's Effective Rebuttal Techniques and Common Issues in Life Care Planning. As you know, a life care plan is a dynamic document that comprehensively identifies an individual's present and lifetime healthcare needs related to the diagnosis or diagnoses given to that individual based upon injuries sustained. The plan, as we know, is individually designed to identify a person's needs and as well as to project a cost for those services and products which are medically necessary to meet the identified needs. So in that process, I'd like to be able to share with you some areas that Reg and myself will provide to you that have been helpful, but also it's not only for reviewing somebody else's life care plan, but it's helped me better prepare my own life care plans when I'm providing a plaintiff's expert report. So we'll go ahead and get started. Again, we need to look at the life care plan and identifying that injured evaluee's future care needs based on medical evidence. And we know that we want to provide a plan that is both rehabilitative and preventative to restore that individual to optimal level of health and functioning within the most appropriate environment. Part of the life care planning process, we want to be able to list the usual and customary costs for all identified care and medical needs. Part of that process is reviewing the public standards that exist for multiple professional organizations, as well as your certified or credentialing bodies. You'll need to make sure you're quite familiar with them and have copies of them at hand to review on a regular basis. It's important to be able to articulate your methodology and the steps that you've taken in producing your life care plan. Not only is that as important, it's helpful for us to be able to review somebody else's life care plan. There are standards, as you're aware, that are published, available to the life care planner, as well as all the parties to the case that will review your standards. So it's, again, I emphasize, make sure you know what those standards are. We see those standards provided by the International Commission of Healthcare Certification, ICHCC. There's also other standards by the AANLCP, the nurse life care planners, as well as physician life care planners. And the one that I'm involved with, as well as Reg, and part of its development, is the professional standards for the International Academy of Life Care Planners, or better known as the LCP. And those standards require life care planners to practice within their scope of practice and make a plan that will further outline the rehabilitation needs for that individual or that evaluee. I think it's important when you're looking at a life care plan and reviewing it, some of the things that aren't in our standards are important in your review. For example, reviewing the medical records when available and appropriate, and the treating and consulting healthcare professionals. And our standards with the Academy also reference our need to consider published empirical research and the clinical practice guidelines. And we want to make sure that when we're reviewing a life care plan as well as our own, that we're following a consistent, valid, and reliable approach in our research, our data collection, our analysis, and the overall process. When we're reviewing life care plans, a lot of times we want to be able to look at the methodology that an individual has considered in development of their plan. And we know this should be a collaborative process. And part of that is obtaining clinical input from other healthcare providers. And in the standards, when the Academy standards, they're pretty specific as far as outlining different ways to adhere to those standards. And I would encourage everyone to make sure that they are following those standards. That way, we can make sure that you have completeness in your plans, and your plans, as well as other plans that you review, will be challenged in these areas. So one of the things we want to do when we're looking at this, at someone else's life care plan or providing a rebuttal or a review, is we want to be able to make sure we look at the information and see if there are consistencies or inconsistencies within the plan itself. We also want to make sure what medical records are being reviewed and what consultations are being provided for that person, evaluee, to make sure that everything is included in that plan. So just some of the basic standards and guidelines that you'll see that you'll need to follow in providing life care plans. So let's go ahead now and move to the next step as far as the rebuttal itself. Some of the steps that we've seen in our practices when we get a referral may involve some of these steps that we'll talk about coming up. So initially, we're usually asked to provide a preliminary review and an analysis of a life care plan. And part of that process, we'll review all the medical records or pertinent records that are provided to us, as well as any testimony and depositions that have been provided. We'll also look at the relevant research and clinical guidelines that may be involved in reviewing the said life care plan. And eventually we will look line by line on the life care planner's methodology, the supporting medical foundation, and if there's any inconsistencies, and in the costs. Part of that process is reviewing that information and also determining if we need other future medical consultations to have a good, valid life care planning foundation. In that process, we'll also make a determination and advise if other consulting services will be needed from other providers, expert witnesses. And the last thing we're asked to do sometimes is to look at preparing deposition questions specifically related to the life care plan based upon our findings and our initial review and analysis. So let us move forward and just talk about some of the commonly observed life care planning errors and omissions that we've seen over the years. Unfortunately, some life care planners may have abandoned some of the basic principles that you've been taught and the process and the methodology to establish a sound life care plan. So in that process, some of the things, as I mentioned earlier, that you may be looking for will be outlined in these slides. And that would include how the individual prepared the life care plans and where did the recommendations come from, such as the items and the services that were included. Again, we want to make sure that this is constructed based upon a collaborative effort and who was involved and what consultations and healthcare collaboration was accomplished in development of that life care plan. We've seen situations where there have been independent decision making, especially on the types of services, including frequency and duration, even up to including surgeries that may or may not have been recommended by the treatment providers or the expert medical and consultants. So as you go through these slides, again, we'll just reemphasize some of the things about reviewing the methodology that's been provided in the life care plan development, how it was developed, and the type of research that was done. Also, when you start going towards cost, you want to be able to review their databases or what multiple regional vendors or resources they're using to determine the cost and the ranges for those future charges. So further discussion, which you'll see in the slides, is reviewing, again, the type of research they've provided, and then being able to look at that research and practice guidelines and cross-referencing it with what's in the actual life care plan that may be included either in the guidelines or in the medical records or depositions, that you can be able to further identify, and is there internal consistency and validity of what's being recommended. Also, it's something that we've seen is, again, providing recommendations without seeking treating or consulting physician's input, as I said earlier, especially regarding frequency and duration. Also looking at neuromedical equipment and replacement items and frequency of replacement schedules, as well as looking at different types of medical evaluations that include medical and allied health evaluations for the evaluee.
Okay. Thank you, Steve.
Yes,
and
sir.
I will take over from this point. So to continue the theme that Steve was talking about there, we're now going to go through what would be considered common characteristics of a flawed life care plan. So again, you are working for a defense attorney and they want you to review a plaintiff plan that has been produced. So let's start out here. So first, does the plaintiff plan have a foundation in medical opinion or evidence? In other words, does the life care plan from the plaintiff life care planner have proper foundation in order to ensure that the individual is going to get the correct treatment throughout their life? So many times, again, as Steve mentioned earlier, I have seen life care plans where individual life care planners are making recommendations for future care that their training, education, and experience does not portend to that or allow them to do that. So as a lesson to you, when you do a life care plan for plaintiff counsel, is make sure that you have the proper foundation so you're not found to be without that proper foundation. Second thing is prices given for services that are not realistic or reasonable. Again, there's a lot of data sources out there that one can tap into. There's several different books that are published with different types of congregate data or aggregate data. There's also different sources like Medicare, Medicaid, those type of things. So there's numerous ways to get prices for services. There's, for example, GoodRx for medications is a good resource for finding prices for medications in the local area. Third thing here, calls for services are not commensurate with the injury. This means that, for example, if you have someone that has a below-the-knee amputation and you're calling for that individual to go to an outpatient brain injury treatment clinic or to a spinal cord injury treatment clinic of some sort, and they do not have that diagnosis in their medical records. So one has to be careful that the diagnosis and the symptoms and complications from that diagnosis line up in your life care plan, and you're not including services that are not called for. And lastly, you have to have the methodology that is consistent with the standards of practice that Steve just mentioned. So again, one needs to be familiar with the ICHEC standards of practice that they have published, and also if you belong to the Nursing Life Care Planning Association, to their standards and or the International Academy of Life Care Planners. The methodologies that you follow are going to be closely scrutinized by an attorney, especially if there's large sums of money involved. Go to the next slide there, Steve, please. Continuation of this, next one is the failure to consider pre-existing medical conditions. So one of the things that we do in our practice is that we ask the same set of questions twice, and meaning that we ask the questions of a common set of questions that are available of the person prior to the incident in question. We need to understand what medications they were taking before, what medical care they had before, and any other medical conditions that could be impactful in your life care plan. More than once, I have seen a plaintiff life care plan that includes medications and the cost for them that are already pre-existing. So you'll be accused of overreaching if you include those costs before. And another thing to think about is everyone needs some level of medical care throughout their lifetime. So if you include, for example, care by a family physician or a general physician, well, maybe only 50% of it is related to the injury in question, and the other 50% is related to normal medical care that the person would get. The next thing to look at is life expectancy. Now, this is definitely a hot button ticket item in the life care planning world. Some life care planners address life expectancy and some don't. We believe it's an imperative to address life expectancy with an individual. There's hundreds of articles on life expectancy on the more commonly known injury types out there. There are many different experts across the country who all they do is offer opinions on life expectancy. So this is something that you need to discuss with your referring attorney. Now, some attorneys don't want to address it because they already got bad facts in the case. For example, they've already admitted liability and they got a very likable plaintiff. And if they think that bringing up life expectancy could harm their credibility in front of the jury or the trier of fact, they may not want you to address life expectancy. Now, another thing you'll run into as a defense life care planner is that some plaintiff counsel will not ask their life care planner to address life expectancy. They leave that up to the defense life care planner and the defense attorney to address that. What that does, it throws the defense attorney into a bad light. Essentially what they're saying is if, for example, if it's a car wreck, if the person didn't kill them in the car wreck, well, now they're going to kill them early by using a life expectancy expert. Now, that's a criticism that may not be warranted, but that's one that will come up. So this is a topic that you definitely have to talk to your referring attorney about because it has a large impact on the future costs and the value of the case. Third item on this slide is the failure to consider the functional limitations or medical limitations before the injuries. Now, this is related to the first point there about pre-existing medical conditions. So let's say, for example, that the individual had diabetes prior to the injury in question. Well, that already sets that person up for a certain amount of medical care already anyhow. And you also have to look about how that affects their functioning in different ways. So cardiovascular health, for example. So one needs to make sure that this is taken into consideration. And again, that you're not overreaching by adding in services to your life care plan if these limitations are pretty obvious. So again, one of the things that you'll see when you're doing a defense life care plan is that a plaintiff life care planner may include all this treatment for those pre-injury functional limitations. So one thing to watch out for there. And then lastly, again, related to life expectancy is the calculations. I have seen cases where the plaintiff counsel has either interviewed the person involved that's injured or have the life care planner do it. And it turns out that the person has someone in their genealogy or the family history that's lived to 105 years of age. So then they'll be pressing the plaintiff life care planner and go, well, they have a relative that's lived that long, so why don't you put that in there that they're going to live to 105 years of age? Well, that's unrealistic. Not everyone's going to live to 105 years of age. So again, that's why you would use standardized Center for Disease Control life expectancy tables, and those are very easy to find on the internet. So we'll go to the next slide, please, Steve. So several issues here of a flawed life care plan. We'll start with the first one up at the upper left there. The plan costs are not reflective or realistic of a regional cost range. One of the standards that we have to follow is that we need to get the cost for the region that the person is in. Now, you may see in some pediatric cases where the person may be moving or the family's moving, and you'll run across that. But typically, I always try to price out a plan that is to the region that the person lives in. I have run across plaintiff life care plans who use a national average. And I think that's somewhat dangerous because it's not reflective of the cost where the person lives. So for example, if a person lives in a low-cost area in the country, much like here in Montana, and you start using national averages, you're going to find that those costs are 10 to 15% higher. So again, you'll be accused of overreaching and trying to run up the numbers on the plaintiff side. So when you're doing a defense plan, that will be something that you will look at to see if they are pricing those costs out in the region. Next thing underneath that is brand name medications versus generic versions. So sometimes the plaintiff life care planner will use all brand name medications, even though the person is only using generic versions. So that's why it's important to ask the defense counsel to make sure to get all of the medical records, including pharmacy records, because you want to see if the person is using brand name or generic versions. Again, this is something you have to go back to your medical consultant with and ask them what's reasonable to include in the defense life care plan, brand name or generic versions. Now, there are obviously some individuals that have to take brand name because they cannot tolerate generic versions. So that's why it's good to collaborate with your medical professional to determine if the person can use either one. Next item here is in-home care versus facility-based care. So again, you have to look at the plaintiff life care plan and see how they price that out. One thing that's very, very interesting is I had a case here a while back where a plaintiff life care planner had no medical consultant and actually made recommendations for a person. The physician I was working with said if that person got a hold of that life care plan and followed it, she literally would have died because of that treatment. And so this person actually was in a nursing home. The doctor felt very strong about that she needed to stay there. If she went home, she would not have the proper access to the medical care that could be provided at a nursing home. And there are some other issues where the plaintiff life care planner made recommendations that could actually endanger her life. So again, this is something you have to work with your medical provider or other expert to determine what is going to be the best place of providing care for the individual. And typically you're going to see that if the person only needs, for example, a personal care assistant or a certified nursing assistant, that's good that they're going to be at home. It's not a good sale on the defense side if you just simply go put the person in assisted living or a nursing home for the rest of her life. I will say you will get pushback definitely from the plaintiff attorney on that during a deposition. And when you go in front of a trier of fact, they'll make light of that your opinion was to lock this person up in a congregate setting and never see the light of day again. So really have to take this one seriously when you're trying to find out what's going to be the best place for that individual for the rest of their life. Next item here is a lack of planning offsets for items that were already being used prior to the injury. So for example, using our individual I mentioned earlier that has diabetes, if that individual has all the supplies for diabetes and the plaintiff life care planner includes that in the plan, well, that's when you go back to what Steve was saying earlier. Go back to those medical records and quote them in your defense plan showing that she was or he was already using these supplies prior to the injury in question. Now, if there's an increase in use of the supplies or equipment or medication, then you need to note that. And I've had that happen before with, for example, an antidepressant, the dosage was doubled. So I write that up that half of that cost should go to the treatment prior to the injury in question and the other half for the increase due to the accident. Next thing here is agency hire without a private hire option. So there's basically two items that drive the cost of a life care plan. It's attendant care and medications. So when it comes to attendant care, you will see generally a plaintiff life care planner will only put in agency hire cost. And typically they're going to be from 50% to 25% higher, meaning, for example, if a agency hire cost is approximately $30 per hour, if you do a private hire option, it can be as low as $15 an hour up to $20 to $22 an hour by using private hire. So our standards of practice, our consensus statements for the International Academy indicate that a life care planner should list both agency hire and private hire, and let the trier of fact decide which one's better for the individual. And last thing on this slide, again, using medical care that was already necessary before the injury. Again, using the person with diabetes, they're going to be seeing their family physician at least once a year, if not more often. They may be seeing a dietitian for weight control and those type of things. Again, you don't want to include those in the costs with a plaintiff life care plan. Again, the defense life care planner will bring that up and take that out. I'll go to the next slide, please. So last, one more up. You went too far there, Steve. One down, I believe. Or is that? Oh, that is it. I'm sorry. So we'll now go to how to approach an exaggerated life care plan. So there's basically three ways to do this, and we'll cover the first one here on a preliminary report review. And this is when you are not disclosed as an expert. So what this means is that a defense life care, or excuse me, a defense attorney will call you and say, hey, I have this plaintiff life care plan, and I don't really have a sense if it's accurate or not. So they will ask you to go through it. Again, you're going to want to get all the medical records you can, know your literature on the particular topic or injury of the person that they have, and any guidelines. And you want to go through that plan and look at it. Again, if they're including medications they were on before, or they have medical care on before, then you can start telling the defense attorney that, yeah, there is some excess in this plan that could be taken out. Now, sometimes it's really not that much, and you'll advise the defense counsel saying, I found just 2 or 3 items that really only amounts to $50,000 or $75,000, and let's just say it's a $3 million life care plan. They're not even going to sweat that. That's just chump change, if you will, when it gets that low. But let's say you go through there and it's pretty clear through the medical records that the person only needs 2 to 4 hours of attendant care per day, and the plaintiff life care planner has 24/7 care. Well, you know that probably 3/4 of the damages in the life care plan are going to be centered solely around that attendant care cost. So that's when you can go back to the defense attorney and say, literature shows that, you use an example here as a para that's incomplete, only needs 0 to 2 hours of care per day around the home with ADL performance, etc. And the plaintiff life care planner has 24 hours. So we need to get an expert physician or other qualified professional in here to assist with determining what is the most accurate amount of attendant care that the person will need. So that's what they'll ask you to just give you a preliminary review. Now, sometimes you will only produce a report as a consultant. So you have to determine that with the defense attorney. Are you hired as a consultant and nothing will be provided to the other side or the plaintiff side, or are you going to be hired in as an expert? As a consultant, you're never revealed to the other side as someone that's working on the case. But if you're declared an expert, well, then that means that you'll likely have some type of report that you're going to turn in. So you got to be really careful when you're using this first one about having anything written, because the attorney may not want it. Now, a lot of this depends on what standards that you have and in what state you are in. So if there's federal standards applied to the case, well, you can share your preliminary work product with the attorney and they will not see that. Eventually, you'll have to turn in a finalized report, but they will not see that according to federal rules. Now, there's some state rules that you have to declare every piece of evidence you have, and that includes any kind of preliminary plan or draft plan. Personally, I do not like draft plans whatsoever. I rarely give an attorney a draft plan. They have hired me for a reason, and I will turn that report in, and generally it's my final report. However, if I'm under, for example, federal rules, they are allowed to review it, the attorney is, and they can give some advice to you about certain topics. One has to be very careful with this, that the defense attorney is not playing the role of a doctor. So if they start pressing you to start removing things that cost money, you got to make sure that you have the medical provider involved with that you've relied on, in order to not compromise your ethics or your standards of practice. Well, the next slide. So this next one is called the side-by-side life care plan review or rebuttal approach. And we're going to be giving you some examples here shortly on how to do that. So essentially what this is you recreate the plaintiff life care plan. And the purpose of this is to show exactly what they've recommended, and then you will be interviewing an appropriate medical professional to get their opinion on if that particular line item is necessary. So you will go line item by line item, asking that physician or appropriate medical provider if that particular item is necessary or not. So basically, when you do this, you're asking the medical professional 3 questions. Excuse me, you want 3 different answers with each line item. 1, do they concur as is? So if the physician or provider agrees with the particular line item and the frequency and duration, then they'll just say concur. The second answer is concur but modify. So let's say the plaintiff life care plan says they need to see a physiatrist 10 times a year. Well, the medical professional you're relying on said, well, I agree that we need to see a physiatrist. However, 2 to 4 times a year is sufficient. So that would be that second answer they have. And the third one is not medically necessary or indicated. And then that's where I ask the physician to provide the reason why it's not necessary. And then I write that up. So once you get the opinion from the provider or medical expert, then you start reviewing all the costs. So I rarely will ever accept what the plaintiff life care planner has put in as cost. The only time I'll do that is if I cannot find that cost for that particular item. So they may have access to some billing that you don't, and they list that cost. But I will say I'll do that less than 1/10 of 1% of the time. There's lots of good databases out there that will provide you the cost for the particular line item. Of course, when you're interviewing the physician or medical expert, you're going to be talking to them about frequency and replacement. And that's just something that has to be at the top of your mind with every one of these line items is the frequency correct, and is the replacement schedule correct for example, medical equipment. And then if you can, bring in peer-reviewed literature or published medical guidelines. Again, you need to be familiar with those resources out in the medical literature. We'll go to the next slide, please. And then a third option here is a collateral source review. So again, this is dependent upon the defense attorney if they want you to do this, and state rules. So I actually do quite a lot of work out in Hawaii, and this is a non-starter there. They have no allowance for a collateral source review. So you may wonder, what is a collateral source in a life care plan? So for example, if a person that is injured, the plaintiff, has some type of medical insurance and they are covering their cost, the defense attorney could ask you to apply their policy to all the future recommendations for care. Or let's say, for example, the person's on Medicaid or they're on Medicare, or let's say they have some type of a managed care policy. So all you'll be looking at there, for example, if you use a managed care policy, is just copays and any kind of premium cost. So if you look at a lot of these policies out there, they'll have a maximum out of pocket of, for example, $7,500 per year. Well, this gets pretty complicated because you got to go in and study that insurance policy and see what they cover. So you have to look at how they cover medications, how they cover therapies, how they cover any kind of medical equipment and medical care. So if they, for example, only pay 50% of medical equipment, well, you have to build a spreadsheet and start adding all this up. So actually, even though this looks simple to do, it's a lot of work because you got to be able to read the policy that's in front of you, and then you also have to be able to build a spreadsheet. Generally, we use Excel, and start adding all that up. And then once you hit, for example, the $7,500 as I used as an example earlier, then there will be no more cost of that because that's the maximum out of pocket. So there's multifaceted angles to collateral sources, and it's definitely one that you'd want the first one you do to have someone look at it, because it can get very complicated. So now I'm going to move on to our next slide, and we're going to show you some examples of the side-by-side. So again, this is just a fabricated injured party here, or valuee. And so under the gold heading, we put in exactly what the plaintiff life care planner has included in their plan. So we actually use the exact titles, so item service, frequency, purpose, unit cost, and annual lifetime cost. So we use that. And we actually put in mistakes and all. And you'll be surprised how often that you'll see mistakes made in these plans. I had a plan here a few years ago that the life care planner had interviewed a medical provider about necessary medications and therapies for a person that was in a nursing home. And the individual that was interviewed told the plaintiff life care planner that it was $1,750 to $2,250 per month. The plaintiff life care planner put it in per day. That ended up to be a $50 million mistake in that plaintiff life care plan. And obviously that was not a good thing when they went to mediation, because that was out front and center, and she had no credibility with the mediator. So one has to be very careful about that. So we actually will include the mistakes they have, and we'll point those out. So looking at this first one, docusate sodium was recommended by the plaintiff life care planner. And of course, they list their unit cost and their frequency. But one of the things they didn't include was a purpose. So we put in brackets, not provided. And as you likely have found out during your time in the training in the program, you have to have a purpose for whatever line item that you include in your life care plan. In this particular case, the doctor concurred with this particular line item. So we'll move over to the green side, and we'll talk about that. So that's where we insert our opinions from the physician and our revised cost. So in this first green column, I actually will get the physician on a file or share a screen sharing software like Zoom, and interview them and actually have them watch me type in their opinions. This is a true collaboration because they're able to watch you type in the opinions, and we'll be showing you that a little later in the presentation. I also put in my opinions in here, since in this particular line item, the doctor approved it and concurred with it. I have no opinions here. And the last column is the revised costs, and we list out the unit costs and the annual costs. So typically we'll just footnote, as you can see at the bottom there, the name of the vendor or provider and what the cost is, and then where a disinterested person can look and see how we got that price. So we're always trying to be very transparent, and we always list out what the source is for the recommendations. Again, this next one is a medication. Again, the physician agreed to that. So one thing you can see here, looking at that bottom one, the plaintiff life care planner had $160 to $171 per year. Well, we came up with $131 to $153. So it's actually quite close in terms of cost. But if you look at the docusate sodium, there's a wide range there. So when you're testifying, you're going to have to know why there's such a wide range. And again, why it's a very good idea to have everything documented on that page so you know what the cost would be. So we'll go on to the next slide. So this one here is diabetic source daily. So again, this is a supplement. And again, they did not provide a purpose, and they recommended 5 cans a day. The physician agreed to that. And I'm going to show you how we price that out. So again, the trier of fact can have a good idea how you came up with those particular line items. So we'll go to that next page. So for this particular case, the person was on supplemental nutrition, and as mentioned, they were using 5 cans a day. So what we did is that we looked up what the cost is for each can that the person needed and listed that out there on that bottom graph. So you can see that there's pretty similar prices amongst all the different providers. So we listed out the providers and the cost per day, and then the cost per year there in the last 3 columns. So again, you can see not a lot of difference there between those providers. That top graph shows what the USDA says what the costs are for of food at home on a weekly basis. Again, we got that from the U.S. Department of Health and Human Services and the U.S. Department of Agriculture. So this is an example of an offset. So the monthly costs for a female 19 to 50, a low of $47.50 to a high of $75. So again, you are showing that this is a common cost that's ubiquitous to everyone. Everyone's got to eat, and so that can be subtracted off from the plaintiff life care plan. So now we'll go to the next slide. Here's a good example of a attendant care sheet here showing that the plaintiff recommended skilled nursing care at the LVN level. Here the doctor actually mentioned that he agreed with the LVN care, but he did mention that a freelance LVN or private hire would be reasonable once the individual completed an inpatient rehab program. So again, following our guidelines, I listed out the cost for agency-based and the cost for private hire. So you can see there's quite a lot of difference between those. And if you have someone that's going to live 30 or 40 years, that difference is going to add into sometimes into the millions of dollars. So again, this is one of the highest cost items that you will price, and you certainly want to be very careful on how you document this information for your medical expert, and then how you document what the costs are for that particular line item. So you can see here in our footnotes, we listed out the names of the providers and then what their cost per hour and then the telephone number. So again, we're being transparent, and anyone should be able to call that number and ask and confirm what that price is for that particular line item. So, so we'll go to the next page, and I'm going to give you some examples of how to price out private hire costs for attendant care. So one of the things you have to look at is all the different aspects that go into private hire. So one of the things you have to look at is bonding. The person that's providing the care needs to be bonded. So in case they happen to steal something from the home, you're going to have a surety bond for that. You also have to look at case management. So depending on the sophistication of the person, if the person has no clue on medical care and could not hire people to take care of them, then you're going to need a medical case manager to assist with all of this care. So you'll put in the cost for a medical case manager. You also look at background investigation. So if you're hiring a freelance or private hire attendant, you got to make sure that they don't have something in their background that could cause them harm. So again, that's fertile ground for a plaintiff attorney to ask you during deposition, have you done included the cost for a background check? Because if they have someone that, for example, has an abusive background or been involved in the legal system for abuse, you certainly don't want that person taking care of this injured party. We'll go on to the next slide. Again, we're listing out at the top there, you can see we list out the places that we obtained prices from and their contact information. And the other thing you want to include is drug testing. And you got to make sure that the person is not strung out on some type of drug that will impair them in terms of providing care to that person. Again, fertile ground for a plaintiff attorney to ask you, have you included drug testing? Because that's something an agency does as part and parcel of hiring process for attendant care. So that is an advantage of an agency-based person. All this stuff that we're looking at here has already been done by the agency. So you got to make sure you include the cost for drug testing. Well, these people also need to be paid, and so you want to put in bookkeeping costs. So again, it's very easy to find these costs for bookkeeping, and these individuals will be responsible for paying the monthly cost or every 2-week cost for payroll. Lastly is advertising. You've got to advertise in order to find a person to provide these services. So we include the hometown, generally, newspapers. We also look at online job boards like Monster or Career Builder or Indeed. Again, you got to put in what the cost is for that. And if you want to put in a plug-in to going to the conference here this fall in Houston, Texas, actually 2 of our staff members will be providing a presentation on how to do this in more detail. So at the bottom there, you'll see that we do put in 2 to 3 weeks of an agency-based attendant in case the freelance attendant cannot show up that day for a variety of reasons, or they're on vacation, etc. So you do want to plan in for 2 to 3 weeks a year of agency-based costs for that person. Yeah, so we'll go to the last slide, which is our summary slide.
Yeah, Reg, and just right before you do your summary,
sure.
Just a couple of things that, as well as I've experienced, is things to be thinking about when you're reviewing the life care plan of someone else. It's great reminders for yourself. And remember, we're looking at that this life care plan is preventative and rehabilitative in nature, and other areas that you want to be able to look at each of the items and services, looking at the beginning of when it's implemented and when it's ending. And what's interesting from what I've reviewed is sometimes you'll see time frames for services that overlap within the life care plan. And I literally reviewed a plan one time, and if I counted up the number of hours in a day that they had to participate and all the activities that was being recommended for this individual with a high-level spinal cord injury, they literally had been in treatment somewhere between 15 and 16 hours a day. And so that just was unrealistic. So you have to ask yourself, can this plan be implemented? And then also, Reg talked about the cost information. We want to be transparent, not only in our own plans, but I do see plans where the sources of cost information is not known or documented. And I think that's important because we should be able to duplicate what's being provided in the life care plan, because this is a care plan for that individual. Although it may be developed for litigation purposes to assess and review damages, the reality is, can this be implemented, and what are those resources and sources that are being used? And we want to make sure there's consistency within the life care plan itself. And then one last thing, and I know there's others we can share with you, is make sure that you review the CPT codes that are being provided to the services. And sometimes we see inconsistency of what's being recommended in the life care plan versus what's actually in the medical records or from the physician's recommendations or even in depositions. So those are just a few things you might want to look at when you're looking at a plan of someone else's. to keep mindful for yourself as well. So Reg, I'll turn it over to you as we summarize our talk.
You bet. And thank you for those points, Steve. Very good. A quick comment on those CPT codes. I've recently had a case where the plaintiff life care planner was using CPT codes that were discontinued over 3 years ago. So that tells you that that individual is probably doing some copying and pasting and not really paying attention to their work. So if they actually went in and looked up that code in a national level database, they would have found out that that code was no longer being used. So it really certainly called into question that they were being accurate and that they were actually up to standards in terms of using proper foundation and proper prices. So yeah, so we'll move to our summary page and we'll wrap this up. Again, all these points are very, very critical when you're doing a defense life care plan and rebutting a plaintiff life care plan. But really, I'm sure you guys have already thought of this. Doing a defense life care plan actually makes you better at doing plaintiff work, because you want to make sure that you don't have issues in your plaintiff plan that a defense life care planner will easily exploit in their rebuttal. So to summarize here, you must be careful not to forget about considering pre-existing medical conditions. Know the medical records very well, and certainly ask the plaintiff attorney, or excuse me, the defense attorney for all the medical records. Physical limitations. Didn't mention this earlier, but we also cover household production or household services. So how well can the person perform general lawn care chores or chores inside the house or household maintenance or vehicle maintenance? So if the person had several limitations before and they couldn't do that, definitely you got to bring that up if the plaintiff life care planner has included that. Again, look at medical restrictions that the person has. Again, that has an impact on future care. Mitigation possibilities. So has the injured plaintiff mitigated any of their damages? So if they're not following any type of medical procedures or medical recommendations from the providers, and the plaintiff life care planner includes a significant amount of cost for that, even though they know the person doesn't follow those, that's certainly something on the defense side that you should analyze and review. Second to last here, life expectancy issues, always something that you have to bring up with your defense counsel to determine if that's something you're going to address, and that you have the proper life expectancy expert to guide you on those issues. And then lastly, hopefully your life care plan is going to be consistent with peer-reviewed literature and guidelines. So that wraps up this part of the presentation. The next presentation will be an interview with a physiatrist named Bill Rosen. He's actually out of Missoula, Montana, and he will give a talk on what a physician looks for in terms of a defense life care plan. And then I will show an actual demonstration of how we obtain input from him for a case. So thanks again for listening, and we'll see you in a second.